Okay, good afternoon, everyone. I'd like to call this meeting to order of the Licensing Task Force. I'd really like to thank you all for being here in person. And more importantly, I'd like to thank you all for all of the time that you've already put into our extensive subcommittee meetings, the draft work plans, and reviewing all of the materials and data that our staff at the Department of Labor has pulled together. I know you all have very full schedules in your day jobs, and I appreciate the time that you've committed to this important work. I especially want to thank our subcommittee co-chairs and members and all of the DLI staff and partner agency staff who've been part of organizing our meetings, drafting documents, and pulling together all of those data requests as we prepare behind the scenes. This task force is only moving along this quickly because of all the work that you all are doing. So thank you very much. I'd like to pause and begin with roll call, and we'll have Erin lead us through that process.
Thank you. And just so everybody's aware, for the microphones, we don't have enough for everybody. And so please share with your neighbors. And then just if you could hit the button on the right, then it'll turn the microphone green and that means you can speak or everybody can hear you. So Commissioner Swanson.
Present.
Senator Harvey.
Here.
Senator Noland.
Here.
Senator Zolnikoff. Okay. Representative Etchart.
Aye.
Representative Seconder.
Here.
Representative Teal.
Here.
Director Brereton.
Here.
Director Strauss.
Here.
Stacy Anderson.
Here.
Tanner Avery.
Here.
Dr. Brewer. Webb Brown.
Here.
Ed Buttrey.
Here.
Bob Dean.
Here.
John Harding.
Here.
Jennifer Hensley. Troy Jensen.
I'm here.
Tony King.
Here.
Alan Lloyd.
Here.
Brad Longcake.
Here.
Kelly Lynch. Kristen McCauley.
Here.
Amy Narrison.
Here.
Allison Paul.
Here.
Sierra Reisberg.
Here.
Jason Small.
Here.
And Gail Tronstad.
Present.
Thank you. We have a quorum, Madam Chair.
All right, thank you, everyone. We have a quorum. So next I'll entertain a motion to approve today's agenda, if you've all had a chance to see that in your packet.
Madam Chair, I move that we accept that motion or the motion to do that.
Thank
Accept
you,
it.
Senator Noland. Is there a second?
Second.
All right, all in favor, say aye.
Aye.
Any opposed? Same sign. Thank you. The agenda is approved. Before we dive in, I want to briefly recenter us on the purpose of this task force. Our job is to work together to make sure that Montana's licensing system is doing what it's supposed to do, protecting the public while avoiding unnecessary barriers that could keep qualified people from working and keeping Montanans from getting the services that they need, especially in our rural and our frontier communities. We are not here to tear down licensing or to water down standards. We're here to test whether each requirement still pulls its own weight. Does it meaningfully protect safety? Is it proportionate to the risk? And is it worth the cost in terms of workforce and access in Montana? By early September, we owe the governor and the legislature and the people of Montana a set of concrete recommendations, including proposed legislative changes for the 2027 session. That deadline should guide how we use our time today and how we continue to use it over the summer. You'll see in your packet and on the screen an initiative matrix. This is based on the actual wording in the governor's executive order. When this task force was created, the executive order did not just give us a general mission. It spelled out very specific initiatives and questions that we as a group are expected to answer. Those include, for example, where licensing is clearly necessary for the health and safety of the public and where it may go beyond what is needed to protect that health and safety. How our rules affect Montana's workforce participants and access to services in the high demand fields in our rural areas. And what steps we can take to improve portability or reciprocity for qualified workers that are moving into Montana with licenses from other states, or for Montanans that are attempting to move around Montana with the license that they hold from our state. How can we address barriers for previously incarcerated Montanans who are ready to work and trained to do so? And how will we keep the system of licensing in Montana modern through ongoing review or potential sunsetting of programs or requirements, ensuring that after all the work we put in throughout this biennium together, that this modern workforce system continues to be evaluated from time to time to keep that moving. The initiative matrix in front of you is our way of turning that charge into an organized work plan, because we have a lot to do in very short order. Down one side are the actual initiatives themselves that were laid out by the governor in our executive order. Across the top are our 4 subcommittees: barriers, construction, healthcare, and sunset. In each box, you'll see which subcommittee has already taken responsibility for which initiative. You'll see that some subcommittees have overlapping jurisdiction over these initiatives. And in many cases, what questions or outputs they plan to deliver by spring or summer. So when you look at the subcommittee work plans today, as we dive into all 4, it's not just a list of interesting topics. This is our roadmap for addressing the very specific questions we were given and a path to bring back concrete recommendations by June, August, and ultimately in our final report to the governor in September. The matrix will help us check 3 things. First, to make sure that every part of the governor's charge has a clear home and that someone is working on it over the next coming months. To make sure that we are not duplicating effort or leaving obvious gaps in the work before we issue the report. And third, by the time we reach September, we can show exactly how our recommendations line up with each of the initiatives we were tasked with solving. As we go through today's agenda, I'll ask you to keep that matrix in front of you. If you see an initiative that looks underserved or unserved, or a place where your subcommittee clearly has a role but is not yet reflected, this is the meeting for you to flag that for us so we can keep these conversations going in the next few months of subcommittee meetings. With that framing, I'll now ask our staff to give a brief overview of the executive order initiatives and walk us through this matrix that's in front of you.
Thank you for your patience. Okay. Thank you. So up on the screen, you can see the matrix that is in everybody's packet. So basically, you should all remember during the organizational meeting for each subcommittee, we talked about these and I listed out all of the different initiatives within the executive order. And then together as a subcommittee, you decided which ones you felt were the ones that you were going to work on that made the most sense for each subcommittee. And at some point, somebody had asked or suggested that it would be a good idea to kind of see, once everyone's decided what to work on, a matrix, just so we can make sure that we're covering all the bases. So I think it's pretty self-explanatory. You can tell that there's definitely some that are very, very specific to a subcommittee. For example, the very last initiative that says if the state should implement a sunset review of the licensing boards, the sunset subcommittee is the only one that's taken on that initiative, which makes sense. Similarly, the healthcare specific ones are just the healthcare committee. But there's also a couple of these, maybe it's just one, that all 4 subcommittees have kind of called out. And I believe there was a discussion at one point to see if maybe it would make sense once all of these have been set, if every single subcommittee needs to address all of these initiatives, or if some could focus more on one than another. And so a lot of the conversations have been around the public benefit, the cost of licensure, if requirements are necessary, and stuff like that. And so most of the subcommittees have decided to kind of focus on those types of the initiatives. But that's what this matrix explains.
Thanks, Erin. And for the record, I do see that Senator Zolnikov has joined us. If you'd like to add him to the roll, we'll see him online. Thank you. So thanks, Erin. With that overview, we're going to move into the heart of today's meeting, reviewing and refining each subcommittee's work plan that you've developed so far. For each subcommittee, we'll follow the same structure in our conversation today. A concise overview of the work plan from the co-chairs and any discussion by the full task force on that subcommittee's scope, on their priorities, and public comments specific to each subcommittee's work plan thus far. Our goal here today is not to wordsmith every single line of every subcommittee's work plan. We want to focus on confirming that the focus and the sequence are right, that the initiatives are properly covered, and that the co-chairs have the guidance from the full task force that they need to move forward. As we get closer to the final report in September, we will have plenty of time for wordsmithing. Feel free to throw out your suggestions today, but let's not get lost in the weeds of exact wording, as the subcommittees still have a lot of work to do. So we'll begin today with the barriers subcommittee. This group has been focused on the obstacles that could keep qualified people out of licensed professions in Montana. That may include criminal history rules, any duplicative requirements, inconsistent standards, or administrative delays, anything that's delaying us from quickly and timely issuing those licenses. I want to again thank the barriers co-chairs, Representative Seckinger and Director Strauss, for leading us through this work, and for the committee members on this task force who have already spent considerable time developing a thoughtful work plan and beginning to identify the data and stakeholder needs for this section. I'll now turn it over to the Barriers Subcommittee chairs, Director Strauss and Representative Seckinger, to walk us through their work plan. How have they mapped the executive order initiatives to what they plan to tackle first, and what they expect to bring back to us by our next full meeting. So with that, Representative, Director.
Rochambeau. I can start, Representative, if you don't mind, and then please feel free to jump in. Thank you, Commissioner Swanson. Just to kind of give maybe just a high level perspective on what we've done so far in 2 meetings to date. The first one really focused primarily on just idea generation, open conversation amongst all the members, and then significant public comment as well. Ms. Sullivan did a really good job of collating that information for us and organizing it in a way that we can start to translate it into the work group committee member topics. You'll see in our overview that we took a lot of that information and conducted a poll of all of the members to kind of prioritize the issues that we wanted to present on. That's the colorful graph that I didn't even know was a possibility. So that's amazing. As you can see, barriers created by license requirement was the most popular of the potential topics that we want to talk about and going through them. And I don't know, Commissioner Swanson, if you want us to read through the various topics for the record, or if we want to just kind of just talk broadly about what our plan is.
I would like you, for the record, so that our folks listening at home that haven't been on the subcommittees know the work that you've identified.
Sure. So based on that basic call for information in the first meeting, organized into 8 distinct topics for us to schedule for future conversation. You can see on the back of the page that the very first meeting that we had focused on 2 of the buckets. One, barriers created by license requirements, and then administrative efficiencies and delays. So moving forward on the agenda, Ms. Sullivan is organized in a way for us to be able to address each of the 8 distinct topics in kind of a formal conversation. And then I suspect, based on the first meeting, that there'll be some kind of vague ideas or recommendations about what we might draw from each of those topics. So just to go through them in subsequent meetings on May 8th, we plan to talk about portability, reciprocity, and alternative pathways. Recognizing emerging or non-traditional roles. Moving forward in June, we're talking about training, education, and scope of practice issues, 5 workforce shortages and service access, and then on July 10th, talking about re-entry related barriers and rural and geographic barriers. In the first meeting, and feel free, other committee members, to fill in the gaps. From my memory, there were 2 kind of primary issues that were brought forth for consideration or discussion as it relates to administrative inefficiencies and delays. We spent a lot of time talking about age restrictions on specific licensure and whether or not they are appropriate. There was a lot of conversations about certain restrictions on licensure that are outside of either, federal mandates or perceived industry restrictions that maybe we should reevaluate whether those are appropriate. Another prominent conversation had to do with provisional licensure, whether or not fingerprinting background checks was the delay that we were discussing, and what impacts that has on people being able to get to their work while that is being processed, and wondering if there's an access or an avenue towards getting people issued a provisional license in anticipation of those delays being met. And that might be a question I have for you, Commissioner Swanson, is an output of these particular conversations, like that one we've learned maybe could be addressed through either direction to boards or through rulemaking rather than through a statutory change. And wondering from the committee, do you want those types of recommendations to be included in the final report as well? Like, please tell the boards to do this type thing.
Yes, if there are recommendations around administrative rule change or as simple as just process change at the department, we would like to know those as well.
Great. I would offer up any other committee members that wanted to kind of provide insights and generally speaking about what the ideas for the barrier subcommittee are, or specifically what topics we kind of broached in the first meeting. I'd be happy to pass the mic.
Representative Seconder, as co-chair, did you have anything else to add to the work plan of your committee?
No, Commissioner, we approved the work plan on Friday with unanimous consent. And I will add that we spent a lot of time on letters of good moral character. And is there a statutory definition of that? And should we have a statutory definition of good moral character in the state of Montana? Or what should we do with that part of licensing? Outside of that, I think Director Strauss just saved me a lot of embarrassment, and thank you for that, good sir.
Okay, other members of the Barriers Task Force, do you have anything to add about the conversations or the work that led you to today? All right, so thank you. Let's open it up to a discussion of the full subcommittee or the full task force. And I'd like you to keep 3 questions in mind as we talk about the recommendations from this task force. Are we focusing on the most important issues within the barrier scope? Are there any clear gaps or barriers that you are hearing about from licensees or constituents that you may represent that are not yet represented in this plan? Have we missed anything when it comes to a barrier? And are there any cross-cutting topics that you heard that the barrier subcommittee is working on that you think they should coordinate with the subcommittee that you serve on, where the work is aligned? So again, are we focusing on the most important issues? Did we miss anything? And from a cross-cutting perspective, is there duplication with any of the other subcommittees that you want to point out so we make sure we're coordinating this effort moving forward? Anyone have any input? Okay,
Sorry,
well,
Commissioner,
yes,
if I could
sir.
ask a question of the barrier committee chair. So I just had a couple comments from 2 different nurses. When I was looking through this nurse RN application process, it seemed, well, the comment I had from the nurses were the background check should be earlier than it is. It gets all the way through 4 or 5 processes before the background check. And the comment I heard was there was a few people that were moving through the program, becoming an RN, and then ultimately their background check doesn't work out. So they just suggested that we move that closer to the front of the process.
Senator?
Thank you. One of the comments and suggestions was, I think everybody in this group has probably had the opportunity to see how a background check works. When we can do a whole bunch of background checks, we could do background checks on everybody at first. But guess what? They don't all cut the mustard. And then if you go through the process first, doing all the things that we have lined out here, and then we say, okay, that would be somebody that would fit, then we do background check. Could be first, but then we're paying for stuff that we don't even use. But if that's what the committee ultimately wants to do, yes, we can do that. When I looked at, because I run a business and I see businesses and I see how that works, I wasted a lot of energy and then some money. And then on the flip side of that, I have other people that are on our board that says, I want like what you're saying, or the nurses or something we're saying, let's step this up and then we can screen out quicker. And so I can see it both ways, which is the best. So if the committee has a specific point why they want to do what they want to do, well, I'd sure like to hear it, because I'm leaning the other way. I don't want to spend the money if I don't need it. But then if it's going to move that process up quicker, because we don't want to stifle anybody. We do want to move things as fast as we can. But so I don't have that answer, but that's what I have noticed.
Thank you, Senator. Ms. McCauley.
So I'm on the Board of Nurses, and that is a conversation that we're having in the Barriers Committee, is absolutely the backgrounds part. However, in the Healthcare Committee that we will be getting to, we're looking at how we probably should look at bringing CNAs under the purview of DLI, and CNAs are a piece that is not being seen quite the same way. And that is the first step of all the rest of the nursing thing. So while it hasn't been brought up in barriers, if and when we look at that, that would be something that would be done early on in the licensure of like a CNA, which would be early.
Thank you. Director Strauss or Representative Seconder, do you have thoughts, or has your committee started talking about either of those, the timing of background checks or potential license alignment across other license types?
Thanks, Commissioner Swanson. I think is generally kind of the tenor of the conversation was around background checks, was just, the timing of it, the outcome of it. So I think it fits within the context in which we were discussing it. So we'd be happy to bring that back for consideration and recommendation.
Thank you. Do any other task force members have input? Mr. Lloyd?
I would just kind of link this up with something else we just mentioned a few minutes ago, and that is the good moral character standard. And I think one of the things that we could do to help folks who do have a history that they might be concerned about is to do more work to document those things so that they understand before they head in, before they take one step down the path, is this a path that they can go down or not? If they have a history that's going to prevent them, how do we communicate that to them as early as possible so that they understand?
Thank you, Mr. Lloyd. Senator?
Thank you. And one of those discussions was defining it, which we talked about last week or this week, whatever times is going by. So we discussed what's important and how do we define it? Because if we can't define it, are we shooting ourselves in the foot, or where are we going to be? So they can do exactly that point. They can look at it and say, oh, my misdemeanor, which turned into a felony. I guess I probably shouldn't go down that road. Good person, repent. That's good. I believe in that. But I think if we define it, like we kind of talked about, so I guess we get to ask the committee here if that's something we want to do, because I know a lot of us think that's the right way to go.
Do any other task force members have input to share related to the Barriers Committee work plan? Ms. McCauley?
So I might add on that is we're just at the end of that last meeting is with background checks, is what is the severity of it, and how old is the felony, and does that really pertain, or does that need to be a barrier for certain types of licensures? Maybe it is if it's a people situation with, patient contact, or when you have direct person-to-person contact, we have a vulnerable position versus maybe some of the more construction stuff where you've got a whole group of people around you and it's not hands-on with people.
Thank you. Mr. Buttrey, Representative Buttrey.
Thank you, Commissioner. One of the other items we talked about in the Barrier Subcommittee related to backgrounds was entity, or I guess an individual that might have multiple licenses, and why we are putting them through the process of background checks and fingerprinting in a relatively short period of time for different licenses. If the states deem that they're a good actor and they're worthy of licensure, should that be enough for the second non-licensed to say, yes, we can get you licensed quicker because we don't have to repeat this process? And we do something very similar in alcohol and gaming licensing, where some years ago we changed the law to say within a certain period of time, if the state says you're good and you apply for another license, you're still good.
Thank you. Any other task force members? Do you have input on the Barrier Subcommittee work plan? Ms. Anderson?
Thank you, Commissioner. So I sat on a few of these subcommittees, and And we are going to be putting together a survey. Ms. Sullivan and I have been chit-chatting just about a draft about barriers for individual licenses. So there is going to be some cross-cutting between some of the other subcommittees, but fundamentally they're barriers. And I also just want to build a little bit on the discussion around good moral character. Working in the healthcare field, there is at least one certification type where putting in a good moral character clause for licensure would be an enormous barrier. So we really have to be smart about that definition. We have to be smart about how we apply it. And we also have to be smart about what moving past early life trials and tribulations looks like when people are looking for profession and career advancement. Thank you.
Thank you. Does anyone else have input on the barrier subcommittee work plan? All right, well, Erin has taken great notes to get us ready for the next subcommittee meeting of this group, but I'd like to move into public comment specifically for the barrier subcommittee topics and the conversation you've heard thus far. If you would like to comment, please come to the microphone, or if you're online, please raise your hand. We'd ask you to say and spell your first and last name and state your affiliation for the record. Is there anyone in the room that would like to make public comment related to the barrier subcommittee's tentative work plan? Okay, is there anyone online that would like to raise your hand about the barrier subcommittee work plan? Okay, well, great work, Director Strauss and Representative Seconder. Sounds like you're on the right track. Thank you very much. Next, I'd like to turn us to the work plan for the construction subcommittee. This group has been looking at licensing in the construction trades and related professions, how those requirements can affect project timelines, overall project cost, safety, workforce availability, or how apprenticeships and training pathways are working and how we might approach reciprocity with other states and how alternative pathways into the trades are working or could work better. Again, I want to thank our co-chairs and members for the detailed work plan that you've put together and the time that you've already spent organizing topics and potential initiatives for this group. I'd now like to invite our construction subcommittee co-chairs, whoever would like to go first, to walk us through this work plan, including how you've aligned it with the executive orders initiatives and what they plan to deliver to this body over the next several months. Senator Harvey, would you like to go first, or would you like to designate your co-chair?
No, absolutely, I'll go. Thank you, Commissioner. And I'd like to speak on behalf of our subcommittee and thank Erin for all her work. We would all be very lost without Erin Sullivan. And we appreciate all the work she does, and she definitely helps to keep us on track and keep us looking good. Like the other subcommittees, our first meeting was really just kind of organizational. I know I thought that we would receive a lot more public comment, and I think we're all kind of bracing for that. And the public comment that we did get was very good and very constructive. And that led to our next subcommittee. And we had the benefit of having the couple 101 courses in between our first and second meeting. And our committee really found some value in that, especially looking at apprenticeship programs and how those intersect with our licensures. We all found that to be very, very beneficial. During public comment at our first meeting, there was also some topics that were brought up, specifically around plumbing, that the plumbing board had a meeting in between and was actually able to address some of those in their own meetings. So good work already happening, and we're making some impact. So during our discussions with committee member topics, many of us had received public input prior to our second meeting. Some of it was submitted online and some of it was members being called personally. So when you look at our list of committee member topics, I really feel that not only portrays what our committee members had brought forward, but also what public had submitted to us. And kind of at the top of mind for our group is apprenticeship and workforce availability. And we had asked staff at DLI to bring forward any barriers or any issues that they saw or areas that they feel they could be more efficient in processing apprenticeship certificates or, getting information out to apprentices to enter into programs. And so we were able to receive some good feedback on that. And that leads to improving access. And that's going to be a discussion that's definitely ongoing. We also talked about, and we know this falls a little bit outside of the task of this task force, but there was actually some public comment brought forward on adding or the possibility of adding licensure to a couple occupations, one of those being around HVAC services. Next, we went into enforcement. Enforcement was a pretty popular topic amongst our subcommittee. We see that it devalues licensure if bad actors are able to just continue being bad actors. So we have some more discussions forthcoming on that, but we felt we owe it to our license holders to make sure that our enforcement processes are public and clear and make it known that they won't be tolerated. Bad actors won't be tolerated. I'm really looking forward to it in our next 2 meetings from now. Coming up in May, we're going to be talking about independent contractors and also construction contractor programs. We feel this will be a good spot when it comes to reviewing what improvements need to be done. I feel where we're at in this process has really been educational, and now it's time to get to work on solving these issues. So as we look at our next couple meetings, that's the direction that we're heading down. So, and then kind of our last main topic is looking at qualifications. And this was another area that we also got some good public comment on. We're finding a few of the licensures in the construction trades, state law often either exceeds or falls short of National Association qualifications. And so it was kind of earmarked on taking a look at some of those National Association qualifications and our state licensure qualifications and trying to find some similarities there. I think that's a great way to go. Many folks are, seeing an advertisement for an industry. They're going to that industry page first, and they may see requirements there. Then they're going to the licensure page on the state website. So the more we can have some good unity there, I think the better off we'll be. So that's all I got, Commissioner, and I'll pass it to my co-chair if you have any.
Thanks, Senator. Mr. Dean, do you have any input?
Thank you, Derek. Thank you, Commissioner. Yes, first and foremost, I have to thank Erin publicly again. She has been an amazing workhorse for us in getting us information and data that we can use for these meetings. So I guess I'd like to point out some improvements have already been happening, not just because the task force or our subcommittee was put together. DLI through apprenticeship programs, the boards, plumbers, electricians, many of them have already begun work on making improvements too, which in a way makes it easier for us. And so then we can utilize those improvements, key in on those improvements, and highlight those improvements that they have made. So I think some of the other topics that have come up pertain to consumer awareness when it comes to licensure and the protection that is offered to both sides with that. And so, like Derek said, when we get into the independent contractors and the construction contractor license. That's gonna, I think, bring some more of that, probably more questions and hopefully more answers along with that. But consumer awareness, I think, is a big missing point out there. They just don't know what they need to know to have the right services performed by a licensed individual. So other than that, I think Derek covered everything very well for where we have been, and just looking forward to keep moving forward and get to work and come back with some good information.
Thank you, Mr. Dean. Are there any other members here of the construction subcommittee that would like to provide additional context or input on this work plan? Yes, Senator.
Thank you, Commissioner. I appreciate our wonderful co-chairs who guided us very well and enlightened us and kept us on the right track. But it wouldn't have done so without Erin's help. So give her another plug. But I wanted to bring up another something that I did bring up, and the chair touched on it briefly. But under the public and clear, the bad actors issue, because one of those issues came up in my neck of the woods, where we had somebody continually doing bad work. This is on roads and water and sewer. And continually, so they get a contract, they do a bad job, they get paid, and then go on to the next project, and don't come back and fix it. So when I brought this up to our county commissioners and then the city council and the planning boards, and they said, well, there's really not any guidelines for us to do, because from my standpoint, I'd rather have the state not get involved in that kind of stuff and let the locals do their job or whatever they want done in their area. But then they said, we don't really have good direction of what we should be doing. And I said, you just make a higher bond for this person so that he's done 4 bad jobs. One of them was right outside my property. And so I got kind of involved in that one. And I said, you tore this road up 4 times. That affects me and my staff. And then we had a couple accidents because of it, because it's off of a highway. And I said, you guys got to fix this. And they said, no, you need to fix it as a legislator. And I said, well, okay, there is some talking. So I was appreciative that, I think it was Representative Harvey was conducting that meeting. And I want us to give the right direction so the people, these bad actors that continually, I found out that he did 3 more. So there's 7. And I go, okay, when's enough's enough? And I think we need to address that for these counties and these cities and municipalities. And the last thing on apprenticeship that I brought up, I've had people come up and say, we didn't know about that apprenticeship. That's a great idea. I go, what rock have you been under? But I didn't say it quite like that, because our wonderful commissioner has really done a really good legwork to let these things be known, but water's still not getting all to the end of the row, if you will, those farmers in the room here. So I think we still have work to do on that, Commissioner. I've seen your posts. People need to be aware of it. How can you force a person to drink water if they won't come to the trough, right? Well, I don't know how to do that, but I'm still hearing it. Well, I didn't know about that. So I have been directing, and I brought this up to people to go to the local job services. Thank you. And they go, oh yeah, because they don't. They go to Indeed, they go to Facebook, they go to all these other things. And then they went back to this. Oh yeah, job service. And that's really a key thing, that if they went there, they went to the job site and they would have been directed right to it. We have this program coming up. Oh, you missed last week. So there's another one in 3 months. But I think we still need to work on that.
Thank you, Senator. So let's open this up to the full task force. As you react to the work plan of the construction subcommittee, I'd again ask you to consider 3 things. Does this plan address the biggest licensing barriers that you are hearing about from your constituency in the construction sector? Are there any critical workforce or safety issues that are missing on this? And what cross-cutting topics, things like reciprocity, data needs, or enforcement processes, should be coordinated with the other subcommittees as we move forward? Mr. Harding, would you like to go first?
Yeah, thank you. So our industry has been interested in seeing how the legislation from last year, HB 239, is going to ultimately play out with the department regarding licensing standards, application requirements, unprofessional conduct, consumer complaints, potential disciplinary action that hasn't actually been defined yet. And I'm just excited that we're having more conversation about that, and probably going to be a big portion of the meeting on May 29th about what we talk about. So looking forward to that opportunity.
Thank you, Mr. Harding. For the committee members and our friends at home, could you identify what your industry is for those that might not know you?
Yeah, well, specifically, I represent the building industry in Montana, not specifically MBIA as far as a part of the board and being directed by the board, but certainly a advocate of Montana Building Industry Association.
Thank you, Mr. Harding. And because you brought up the legislative change last session, House Bill 239, which created a category of licensure for construction, we do have Representative Teal, who is the sponsor of that bill, on our task force and on Zoom. Representative Teal, do you have anything you'd like to add related to that bill that you carried last session or the task force's recommendations in general?
Thank you, Madam Chair. I don't have too much to add at this time. I am looking forward to our next meeting to kind of get into the weeds on some of this a little more. And yeah, just continue the conversation about what some of those effects will look like. But I do think it's a step in the right direction for addressing a lot of the concerns that we're kind of hearing at this point. Yeah, I think it was a great first step, and we can keep working on it.
Thank you, Representative. Do any other task force members have questions you'd like to ask of the co-chairs or input you'd like to add about whether or not we're addressing the biggest licensing pain points, what cross-cutting strategies we have, or if there's any safety gaps that we're not addressing? Mr. Jensen.
Thank you. I just wanted to add a couple of things that I thought was interesting being on this subcommittee is living as far east, sometimes the water doesn't get all the way to Sydney. And one of the things that was interesting is some of the public comments that we received was there was a Montana Electrical Training Center here in Helena. I didn't know that existed in Sydney. And they were really awesome to hear them talk about their program and what they're doing. And it was brought up because of the apprenticeship program and going through that. And then also there was a group from, I believe it's from Butte, that had also a training center there. And they said that they were full or almost full capacity, like 40 some students, and they're going through the apprenticeship program. And so there is a couple of facilities that, again, in my mind, that's so far west that I'm just not aware of it, that I thought was awesome to hear about. And I think there's something to tap into there as to the apprenticeship program and something for this committee to look at. And in my mind, I was like, well, maybe there's more programs out there that we're not even aware of, that maybe we could provide links from the apprenticeship of these programs in Montana for students and potential licensees. Here's programs in Montana you can go to that know the pathway, that know how to get licensed in Montana. So that was a thought that I had. So.
Thank you, Mr. Jensen. Do any other task force members have input? Ms. McCauley.
Yes, thank you. So as the apprenticeship comes up in this comment, I think this is a cross-cutting point. And touching back on this notion of backgrounds earlier in the process, as this apprenticeship gets launched and we see this happening, I think it would be as a broad perspective for Department of Labor and Industry to be considering apprenticeship licenses. So when we're looking at plumbing apprenticeship, the contracting apprenticeship and nursing apprenticeship, that there should be some sort of a license as they're entering this learning opportunity. So we're getting that background done early, and then also have that the ability to follow through with complaints and evaluation.
Thank you, Ms. McCauley. Could I restate back to you what I think I heard, which is to consider creating additional categories of licensure for the apprentices themselves before they've fully achieved licensure in that occupation? Is that?
Absolutely.
Okay, thank you. Do any other task force members have input onto the subcommittee work plan for construction? Anyone online? Nope.
Committee members, no.
Okay. So with that, I'd like to move us into public comment on the construction subcommittee's topics. So same process. If you're in the room, please come forward, state your name, say and spell your first and last name and your affiliation. And please share with us any input you might have on the construction subcommittee's work plan. Okay, I see some head nods no. So does anyone online as a member of the public have any input into the construction subcommittee's work plan? Miss Adrienne Cotton, would you like to go first?
Good afternoon, everyone. Can you hear me?
We can.
Fantastic. Thank you so much. My name is Adrienne Cotton. I represent the Montana Building Industry Association and just wanted to drop a couple notes. First and foremost, thank you so much for all the work you are doing at Department of Labor and Industry and all the members on the subcommittee. We have been listening to all the meetings and your staff are doing a fantastic job and everyone involved is really doing a great job as well. Just real briefly on discussing bad actors. I just wanted to touch on support for that public awareness being the most powerful accountability tool that we have for bad actors. An informed consumer is such a better check than any, efforts that we can make through a state agency. So the more that we know that homeowners know how to verify licenses, check complaint histories, required lien waivers, and read references, we believe that our industry will be a lot stronger. When we have problems on a job site, sometimes there's a lot of nuance to issues, whether there was weather issues, supply chain issues, scope of work disputes. And so and I believe Mr. Harding mentioned this, while we work through the changes of contractor licensure and the new program in Montana, we're really looking forward to getting a better feel for exactly what kind of complaints DLI is receiving and then helping really push that message of public awareness. Thank you.
Thank you, Ms. Cotton. Next up, we have Mr. Jack McBroom.
Sorry, now you can probably hear me. Thank you, Madam
Yeah.
Chairman. Members of the committee, my name is Jackie McBroom. I represent IBW 233, the Electricians Union. I'm also one of the trustees for our JATC program. And I'm glad to be here today with you and be on all these meetings. I'd like to say I'd like to chime on with what Adrienne Cotton had to say. I agree with her comments as well. And I'd also, to keep it short and sweet, I'd like to have an open invitation to any of you there that would like to see our apprenticeship JATC. We'd love to take you through the building. At any time, we have increased it from the capacity of 200 to now 400. So we've doubled our capacity that we could have in that program as well. So again, I'd like to thank everybody that's been on the committees and for doing this fine work. Just know that everybody's out there and listening to what you have to say, and we think some things could get done, and appreciate your time and your efforts. It takes a lot of energy to get these things done. So and with that, I'll let you guys continue onward, and thank you very much.
Thank you, Mr. McBroom. Are there any other members of the public online that would wish to make a comment? Please raise your hand if so. Okay. Well, thank you for those insights. They will be recorded and shared back with this construction subcommittee as it refines its work. And on behalf of the co-chairs, I would ask you to take a peek at the licensee lookup of how the public can look at the status of a license. I didn't see that on your work plan. I know that is a feature we make available at the department to all categories of licensure, but if we could take a look at whether or not that's meeting the need and any recommendations you have for the department administratively, I'd really like to know if we can make that better. So we'll now hear from our friends on the healthcare subcommittee. This group has been focused both on administrative burdens for licensees and the pathways into licensure for health and behavioral health fields, with a strong emphasis on rural and frontier access around Montana. This group received a thorough presentation last Friday from Director Brereton at DPHHS about the licensure policy alignment with Montana's Rural Health Transformation Program and the work of this task force, and is just beginning to work through alignment of those commitments to find where any alignment might be possible with the work of this task force. They continue to look at issues like background check timelines, compacts, reciprocity, telehealth, scopes of practice, and how we attract and retain providers across Montana, especially into our rural and remote communities. Thank you to the co-chairs and to the members for building a really comprehensive work plan and for coordinating with other statewide health initiatives like the Rural Health Transformation Program. I'd like to invite our subcommittee co-chairs, Representative Etchart and Mr. Tony King, to walk us through their work plan and how it lines up with the executive orders initiatives and what they expect to bring back to the full task force this summer.
Thank you, Madam Chair and members of the committee, and also a big shout out to Ms. Sullivan. Thank you so much for organizing all of our committee meetings. So the healthcare subcommittee does have some overlap, of course, with RHTP. Thank you, Director Brereton, for your excellent presentation last week, and also with the barrier subcommittee. Some of the things that we are definitely looking at are with RHTP, we need to meet the increase in licensed professional goals set out under Initiative 1 of RHTP. And with that, like I said, there's a lot of overlap with the barrier subcommittee. And in order to do that, one of the things we're also looking at that we placed in the parking lot is making sure that rules and regulations are set so that we don't have barriers to healthcare licensing as well. So also as medical schools, PA schools, APRN schools, dental schools, and things like that increase in the state of Montana, we also need to see that we have preceptorship increases as well in the state of Montana so that we can get more people licensed and into the workforce. Currently, we have several compacts that are already existing in the state of Montana. Just a few are the psychology, interjurisdictional compact, nursing compact, and PA compact. And looking forward, in order to increase compacts in the state, we could look at possibly social work, EMS, dentist, compacts, hygienists, and APRNs as well. And then we're expanding on those current compacts also to help meet RHTP goals in our current participation in the compacts. So that helped us meet some of those RHTP goals. And then we want to make sure that we have consistent standards across states, also to fulfill compact requirements and to just make it easier if someone from a surrounding state moves to Montana, or say you have someone in the military that's moving to Montana as well, they bring family members with them, that we want to make sure that we're plugging into the workforce in Montana. Apprenticeships, they ease entry into the workforce through apprenticeships. Also with telehealth, we want to include availability, making sure that patients can access telehealth, and as also that there's reimbursement to that. So we will closely work with insurance companies to make sure that that exists as well. One of our big pushes, as we have seen in the state of Montana, we have made great strides in making sure that all of our licensees and our professionals practice to the full extent of their education and training. That's a big group issue here for us. That also coincides and overlaps with barriers, making sure that there's no barriers to people being able to practice to the full extent that they were educated and trained to do. And one of the other things that Ms. McCauley brought up earlier is looking at all licensing that occurs under DLI. There's also some that occur under DPHHS, including CNA, so we are taking a close look at that. And we are looking at any way to best facilitate individual groups and programs and combining professional licensing where possible from a board to, say, a program, to decrease barriers so that there's less of a wait time, for instance, for non-routine license types. And Commissioner Swanson, that was all I had. Thank you.
Thank you, Representative Etchart. Mr. King, would you like to add?
Thank you, Madam Chair. Thank you. I think Representative Etchart did a very good job summarizing it. We've had 3 meetings to date. We've had one thrown in last Friday. We are also meeting this following Friday. Looking forward to touching on the topics brought forth by the RHTP. I did want to comment, we did get great presentations from the Department of Labor and Industries, Kevin and his staff
bringing forth info. We've been asking some off the wall questions, trying to really get to the heart of what we're finding or what we're hearing from other healthcare licensees. Very, very responsive in the info. And again, thank you to Aaron for putting that together. What we've found out in our first initial couple meetings is if there seems to be a big lag in healthcare licensing, a lot of time it was on the applicant themselves. It wasn't on the Department of Labor and Industry. So anything that seemed like it took a long time really was dragging out, probably getting the paperwork all lined up. A huge kudos goes out to the Department of Labor and Industries. They have seen the number of licensees increase dramatically over the last couple of years, but have not added staff in order to do that. So the efficiencies that they're seeing are creating inside their processes, as well as standardizing it from healthcare licensee to healthcare licensee, has really made them robust and can pivot quickly. We did ask about, are our costs consistent with the licensure, or perhaps their salaries? Are we keeping good applicants out because we're too high of cost, and we're not seeing that. I'd also echo what Representative Etchart is. We want our practitioners to practice at the top of their education, not necessarily their licensure, but what are they capable of doing? What do they want to do? What are they trying to do to be innovative? What we've got a couple of times, and I know I have, and I'm sure Representative Etchart is we need to find some sort of consistency in payment, consistency in insurance billing, and going forward. Each of these meetings, obviously, is very important for our public to be able to participate and give public comments in here, and we value that. What we're hearing in ours and some of the other committees that I've been listening in on is we want to be able to free this up, but we also want the public to be safe. So we're balancing a very fine line here of what can we do, but yet keep the public safe in it. And so we appreciate all the comments that we're getting from those that are participating in the meeting. We do have a couple more meetings coming up. We're looking forward to those. Like I said, again, next Friday. And we're excited to bring something forth back to this full committee for recommendations.
Thank you, Mr. King. So let's open this one up for full task force discussion, please. Some of the key questions I'd love to hear from you on are: what are the biggest barriers to health and behavioral health workforce included in this plan? Are there rural or frontier access issues that we are hearing about that are not yet captured in this work plan? And are there any areas where healthcare needs to intentionally coordinate with the construction barriers or sunset committees, for example, on reciprocity, telehealth, or criminal incarceration histories? What input does the task force have for us on this work plan?
Madam Chair.
Do we have someone online? I'm sorry, Erin, your screen is shared. Ms. Hensley, task force member online. Please go ahead.
Hello.
Yes, we can hear you,
Madam
Jen.
Chair. Awesome. Hi, everybody. It's Jen Hensley coming at you live from the highway, pulled over, totally safe. I think that there was some conversation around background checks in the healthcare subcommittee as well. I think that that would be a good topic to coordinate with the barriers subcommittee, not only on the timeline, but the necessity, et cetera. So many of the same issues I think would be relevant. And then I don't know if now is the time to ask, but in Director Brereton's excellent presentation of RHTP and given the exciting time that this is for the state of Montana and the people of Montana around the RHTP dollars, there were some policy adjustments that do need to occur for us to make use of those dollars. And I just wanted to put that on the table for discussion and figure out if that is the case, then it doesn't feel like it's really optional for the healthcare subcommittee to say yes or no on, or this task force to say yes or no on. And so I was just kind of wondering if those for certain are being included in moving forward in any legislative package that we're recommending to the governor.
Thank you, Ms. Hensley. I'd like to re-refer that to Director Brereton if I could. For those of you that aren't on the healthcare subcommittee, that meeting and that presentation is on the licensing task force website. You're welcome to go watch. Director Brereton and his team did a great job of overviewing the rural health transformation program and some policy commitments that are before us on this task force that might need to be addressed. But I'd like to invite the director to speak to them.
Sure. Thank you, Madam Chair. Good to see all of you here at the task force. So first and foremost, would encourage all of you to watch the presentation that DPHHS provided to the healthcare subcommittee this past Friday. We spent about probably 30 to 45 minutes presenting on the various rural health transformation program policy commitments that were made as part of the state of Montana's application to CMS in late 2025. I think the two that will require certainly input from the healthcare subcommittee, but also this task force, are the EMS compact. So I believe that's something that the Department of Labor and Industry and Commissioner Swanson had brought to the full task force's attention, potentially during our first meeting or during another forum or opportunity. The second one is related to dental hygienists and their scope of practice. As we talk through these things, Madam Chair, we may want to spend a bit more time as a task force digging into these various policy commitments that were included in the plan. But I'm also sensitive to the timeline that DLI is operating under. Of course, task force members could go back and watch the presentation, but welcome your input on that just to make sure that everyone has the information that they need.
Thank you, Director. Ms. Hensley, did that answer your question?
I think it did somewhat. Yeah, I know that everything is kind of happening at the same time. So I just wanted to make sure that we're watching all the balls as they're in the air, and that we don't miss an opportunity to either, give input or a blessing or whatever the department needs to make sure that RHTP can happen.
Sure. Madam Chair and Jen, would add to, just for the full task force's awareness, another area that absolutely will require your input is related to implementing a nutrition continuing medical education requirement through the Board of Medical Examiners. So my team will be before the Board of Medical Examiners in late April at their upcoming meeting to present again on this topic, but wanted to come back to that requirement too. Madam Chair.
Thank you, Director. Do any other task force members have input on the healthcare subcommittee's work plan? Senator?
Thank you, Madam Chair. I'm hoping I can get some clarification, and those who were on the committee that heard this, because when I heard it, I got in just a little bit late because we're human and we have to go do other things. Even though we're on the committee, you have to go do something else, and it might be a bathroom break or something else too. So anyway, this particular thing comes to Director Brereton. If I heard correctly, so I'd like some clarification. Education, anything we do in the state of Montana, we want to include and have included our families, the public. And I'm not a proponent of having government dictate, and so that might be the wrong word, but force, that might be the wrong word too, because I want that open to the public. So if I misunderstood that, because there's a body of us that want, and the people that are listening, thank goodness for the public comments, and that's people that care. They're trying to be involved in what the government's doing, and then a lot of them call us. And that's why I'm glad that they feel like they can reach out to their representatives and senators. So I need some clarification for those who might have been on the call. And then maybe, Director, if you could chime in, because if it was said that we want to have the say as a government, I'm not in favor of that. I'm in favor of having as much public comment as possible on our education, or whether it be with children, healthcare, whatever. I want the families to say that there's already been provided for the youth or people. Thank you.
Madam Chair, Senator Noland, would you specify or clarify what particular policy commitment you're referring to?
That's the problem. I was saying I stepped out and I came back into, so
Got
I
it.
don't know
Oh,
where you,
okay.
and so I heard
Yeah.
something and I go, I probably should have asked you,
Sure.
Chairman, but I didn't, because I said, well, I'll hear this and I'll go back and look at it. And then I didn't take the time. So that's what I was asking. If anybody else heard what I thought I heard, I have that as a concern. So if anybody has that.
Commissioner, Director Brereton, it could have been in the part of the meeting we were talking about the continuing education requirement with the nutrition and the fact that we have not mandated those continuing education requirements as a state for some time. And now looking to do that for the nutrition component because of the scoring value it gave us in our HTP. That could have been it.
Got it. Yeah, thank you, Representative Buttry. So, Senator Noland, CMS, to be clear, and that's the U.S. Centers for Medicare and Medicaid Services, was not mandating that states implement a nutrition continuing medical education requirement. But they did, the federal government did give states the option to commit to that in our Rural Health Transformation Program plan in order to secure some more points, which then translate into funding for the state of Montana. So in the governor's Rural Health Transformation Program plan, we did make that commitment, but of course it's contingent on Board of Medical Examiners approval. It may require, or it will likely require, regulatory changes among other changes. So it was a first step in our plan, but there's a lot of additional work that needs to be done.
Thank you. Could I ask maybe a little more follow-up? So I'm trying to reach out to make sure that those constituents who reach out to me that I represent, that we all represent, their people want to have a say more so than the government. Now, granted, if it gives an opportunity to receive extra funding, maybe that needs to be better explained or explained why we're doing this, because I'm not in favor of having, we can use your department of saying, this is the course we're going to do. If you got a whole bunch of correspondence, maybe you did, maybe you got a whole bunch of correspondence from the public, the lay people, that's why you're able to say this. I have not heard that. So based on that, I have some reservations with pretty much that comment. So if we can either pull that back or help me understand what we're going to do moving forward so that the public has a say what their kids get to eat or drink or their subsistence or any kind of health issue. That's where I am having a little hiccup, because I appreciate you, by the way. You've done some wonderful things, by the way. I don't mean to be digging at you, because I think you've done just an amazing job. I'm so proud of you, but I don't understand that part when that came out. And there's stuff you probably know that I'm not aware of. And if you can't share it all right now, that's okay. But I'm hoping we can address this.
Sure. Senator, I think that more discussions with the Board of Medical Examiners as the true subject matter experts are required. I also want to be clear that CMS or the Trump administration did not give states, as part of the Rural Health Transformation Program, a nutrition CME template and say, this is exactly what you need to follow. The guidelines in the federal notice of funding opportunity were pretty broad in relation to that nutrition CME. And so states and likely our Board of Medical Examiners would have quite a bit of discretion in designing and developing that CME requirement. So more to come. We absolutely need to sit before the Board of Medical Examiners and flesh this out further. Again, it was an initial commitment made in the governor's plan. That was very public, but we have more work to do.
Yes, sir.
Thank you. Thank you for enlightening me on that. So for my peace of mind and moving forward, I'm hoping that when an agency makes a comment, and anybody that's in an agency that comes before my committee, no, I just ask you right out front, what do you do that for? Or I try to do it behind the scenes. And then if I don't get it, then I'm going to do it publicly. So I'm hoping that before a comment, suggestion, we are going to be doing this, is looked at, we consider the best welfare of the citizens of Montana. That's what my goal has always been.
Absolutely.
We want to have what's best for them. And in parents' choice is best, in my opinion, on any level, not you and me. We just happen to be in these titles right now, right? But I want them to feel like they can say, oh, DPHHS is listening to us. You and I both know there's issues that your wonderful agency has a little big lift. Thank you for being there. But I'm just hoping moving forward, that's how we do that.
Thank you, Senator. Senator Zolnikov online. I see your hand raised.
Yeah, thank you, Commissioner. I guess the big one to always just keep eyes on is opening up our telehealth and making it even more accessible so people can choose their doctor across the country. And I know that there's been really good progress made in that direction, but it's important to continue to open that door so licensing doesn't restrict who I can use if I want to use somebody in another state or area, especially when we don't always have specialists here. That seems like a really good way to open the door. So appreciate everything you've done, Commissioner.
Thank you, Senator. Mr. Longcake.
Yes, Madam Chair. In light of Senator Noland and Director Burton's kind of line of questioning, I think he did a fantastic job last week with his presentation, especially with the importance of dental care and dental hygienists with the RHTP. This just is another opportunity for myself to offer up our services. It sounds like there could have been some opportunities where we could have provided additional information or input, especially in the scope of practice when it regards to LAPs or just in general terms of a dental hygienist. I'm not an expert by any means, but happy to be the conduit to provide that connective point between any members on my board or anybody else that might need to be involved to help provide that additional stakeholder feedback. It just sounds like there's been some questions in regards to that. And I just want to make sure, again, I'd already offered up myself to Director Bremerton, but just an opportunity. I thought this was the appropriate place to insert that. So with that, Madam Chair, thank you.
Thank you, Mr. Longcake. Ms. McCully.
Hi, thank you. On the RHTP program, I thought that was a really good presentation, and there was some points, and I kind of brought it up in that moment about asking about scope of practice and the other one, and expand scope of practice in the compacts, and I think that the guidelines that came that the money was linked to introduce the spirit of the program. And so I am hopeful that when we come to the task of deciding CMEs for professionals, that if that's something that is not I think it probably is in the interest of our state people, our residents, that if it's not in their best interest, we'll scrutinize that. And then if we need to pull up another area, like being more productive in the compacts and more productive in loosening scope of or expanding and utilizing full scope of practice, that so not to lose that funding, that we can do better in maybe some of those other areas while we analyze the commitments, perhaps.
Thank you, Ms. McCully. Are there any other members of the task force that want to provide thoughts or input or suggestions on the healthcare subcommittee's proposed work?
Madam Chair, thank you. I wanted to come back to Ms. McCauley's point. I wasn't totally following that, and I wasn't sure if there was a question there. So I just wanted to make sure that we're on the same page.
We're on the same page. No
Okay.
question. I was just wanting to support the expanded practice
Got
and the compact, and like the commitments that you made for those seemed fairly narrow. And I think that when we can work in our subcommittees to do well with that, if we're unable to meet a commitment in another area, I think that we can still meet the spirit of the program and still secure funds through working hard in other areas, if that's something that shouldn't go through for whatever reason.
Yep.
Thank
And on the cutting other committees, I don't want to move too fast if we're not done with RHTP.
You're welcome to provide any input on the healthcare
So
work plan.
when Jen Hensley made her lovely comment about the backgrounds with barriers, I do think there's a real unique opportunity that isn't quite captured by our subcommittees that is directly linked with healthcare and barriers. And specifically with a lot of the barriers are coming from people with background check positives or negatives, however you want to look at that, where they pop up with a background concern. And that's in the incarcerated individual. And the Department of Corrections has the care of and the responsibility to those who've been charged and are in the prison systems. But there is the county detention area that is really underserved, underevaluated, and I don't think I'm overstating it by suggesting that the county detention centers are probably the biggest, largest entry point for behavioral health patients. And the services that are provided there is both hiccup in healthcare delivery and also barrier to work. And so there's a place there that that is not quite being captured by either of these subcommittees directly.
Thank you, Ms. McCulley. Representative Buttry.
Thank you, Commissioner. I just want to make a statement about the compacts. We've heard from Director Brereton that in the RHTP, the big focus is on the EMS compact, but there are currently opportunities for 4 or 5 other compacts, and I think there'll be additional opportunities in the future. I know the good Chair Etchart has worked with me quite a bit on compacts, but I would hope that our committee would look at any available compacts and things that we can enact in state law to bring in more of our workforce and not. I understand why RHTP is only focusing on one, but I think we need to look at the broad range of whatever compacts are out there and available. Thank you.
Thank you, Representative. Do any other task force members have input on the healthcare subcommittee work plan? Anything that's in it or anything that is not yet in it that you believe should be?
Madam Chair.
Yes, ma'am. Ms. Hensley.
Hi, everybody. It's Jen again. I just want to piggyback on Representative Buttry's comment about additional compacts and just to specifically point out the social work compact as something. I lost track of it. If it didn't pass, it should have. Did it pass last session? If not, can we please put that on our wish list? That is
Thank
all.
you, Ms. Hensley. It did not pass last session, so thank you for flagging that as something the committee can explore.
Thank you. I know it's a granular detail, but it's an awfully big one, especially in a state this large that's crying for mental health professionals.
Thank you, Ms. Hensley. All right, last call for committee members. Does anybody else have input on the healthcare subcommittee's work plan? Okay, oh, yes, go ahead, Stacey.
I was getting there, Commissioner, trying to formulate my thoughts. So I've worked in healthcare for over 20 years, and I've come from the perspective of representing clients who are employers, and I also represent clients who are licensees. And I think trying to remember that the individuals who are participating in the healthcare subcommittee are very cognizant of this delicate balance between the health and welfare and safety of our patients, this really tricky dynamic. We work within healthcare where licensure is how we get paid. And then also thinking about the extraordinary challenges of recruiting into rural and frontier Montana and thinking about models of healthcare that work in all the communities of Montana. And I think this committee is trying to tackle some of those. I don't know if we'll get to all of them, but I think that's what a lot of us are bringing to the table are these enormous pressures in the subcommittee and just trying to be sensitive to it. So I just wanted to say that I get that energy from the subcommittee so that for the audience out there who's the public, just understand that we are trying to balance that and really think these things through.
Thank you, Ms. Sanderson. We'll now take public comment specific to the Healthcare Subcommittee's work plan. If you're with us in the room, please come forward, share and spell your first and last name and share your affiliation, and share with us any input you might have into the Healthcare Subcommittee's work plan. Do we have any public comment online? The representative from the Montana Medical Association, you may go first.
Good afternoon. This is Jean Branscombe with the Montana Medical Association. That's the group that represents physicians. And I appreciate the discussion on the goal of having an additional or having a requirement for continuing medical education for just one profession, physicians, on one topic of nutrition. I appreciate that there may have been missed opportunities in the past to have read a document and noted this. We apologize for missing that view of that document, and look forward to speaking with Director Burrington and Commissioner Swanson, particularly on that requirement. Just wanted to add in the piece of this is that currently the physicians in the state do not have any required CME. So this would be a whole new process that's attached to licensing in the state of Montana. Physicians are board certified, and they also, under their contracts when they're employed, are also required to have CME. So there has been CME requirements that's done for them to maintain board certification at the national level, and then also to be employed and work in hospitals or have those privileges. We have had special interest groups in the past that have attempted to pass legislation and on particular interest areas. Those haven't passed. I would just like to tag on to the telemedicine piece as well, because that is extraordinarily important. And to really think of physicians, because it's a unique group. You have about over 13,000 physicians that are licensed to practice in Montana, but really there's about half of those that actually have boots on the ground in Montana. And so a lot of those individuals are working telehealth. And so a group that you might think about is probably over 100 plus of radiologists who are reading images around the world. And we're looking at putting the CME requirement on those to understand nutrition. So that's why it doesn't quite apply to them, pathologists and others, and there needs to be further discussion on that. I also think it's one of those cross-cutting topics. You've got one subgroup that's looking at CME as a requirement that is a barrier to licensing. And with this group, you're asking about adding a barrier to licensing. So again, we look forward, we offer our resources and expertise in regards to the education that physicians continually take to maintain board certification and provide additional comments to you as well. Thank you.
Thank you, Ms. Branscombe. Are there any other members of the public that would like to provide input on the Healthcare Subcommittee's work plan, either in the room or online? Okay. Well, thank you for that perspective. Let's move on to our final subcommittee for today, our Sunset Committee. This group's role is to think about the long term. How do we keep our licensing system modern and accountable through periodic review, whether it's a statute or administrative rule, whether some boards or requirements should be restructured or sunset, or how do we decide when licensure is or is not the right tool for a given profession? I really respect and appreciate the work that this group has already done to start sketching out review criteria and a process that could guide future legislative or executive branch decisions beyond the work of this task force today. I'll now invite the Sunset Subcommittee co-chairs, Mr. Alan Lloyd or Senator Zolnikov, to walk us through your work plan and what's in front of us today as you're responding to the initiatives in the governor's executive order.
Thank you, Commissioner. Alan Lloyd here. Senator Zolnikov asked that I take the first stab at this, and then I welcome any additional comments that he chooses to add when we wrap up. I would echo, I think, every person in this room's thank you to Aaron for all the help in making our meetings work so well and gathering information. I'm going to give a specific one here. our subcommittee greatly appreciated a history lesson, which we received in our second meeting on March 20th. And the history of sunsets in Montana follows somewhat of a wild roller coaster ride of biting off more than probably can be chewed, and then ending things before they've fully run their course would be my my overview of that history. And so I think as the group has gone through and started our discussions, one of the things that we're aware of is that whatever we propose needs to be something that can actually happen in the real world. And so that's been a key aspect. As you can see from our plan here later this month, our next goal is to get some information about other states' approaches to this. Not that we would copy, but if we can learn from other states that have done this already, we hope that that can inform our recommendations. I would then somewhat highlight in importance that meeting on May 22nd. One of the things that we did in our initial meeting was to think of the criteria for a sunset review, and I'm just going to walk through what we have come up with as a list. The first is a review versus termination. Are we just reviewing things or are we terminating them? Who would perform that review? How often does the review take place? What are the aspects that are reviewed? What is the reporting structure? And then we just have a bucket for other as we walk through those things. And so the intent of our subcommittee is to walk through these things and come back to this group with recommendations on how we, eat the elephant, essentially. And that leaves us with our June and July meetings to pull those things together as recommendations. The other thing that I would just highlight, and it's come up in each of our meetings, and Senator Nolan, I'm looking at you, because it's been Senator Nolan's question, and I think it's one that I think the input of the entire group would be helpful here. One of the data points that we've struggled to wrap our arms around is how to gather and collect the input of the licensees. And so the public has a very easy process of submitting a complaint against a licensee, but our licensees that are going through the process don't have a consistent, easy way to report back in the issues that they see. Senator Nolan has asked us at each of our meetings, well, how do we know which one of the licenses, has the most complaints? And the lack of information there has been one of the things we've stumbled through. And so I would highly anticipate that being one of the criteria that we'll put forward. So with that, I would defer to Senator Zolnikoff if I missed anything, or to members of the committee.
Thank you, Mr. Lloyd. Senator Zolnikoff, do you have anything to add?
No, I think Mr. Lloyd did a great job.
Thank you, Senator. Are there any members of the Sunset Subcommittee that would like to add additional comment or context in your conversations? Senator.
Well, some of the members of the committee might remember that I said, let's just sunset them all. It's kind of like what's a zero-based budgeting that the state can do for every agency. Then you have to prove that you really are needed and that you need the funding that you need. That didn't go very well in the state when I tried that. So I said, well, maybe we'll try it here. But then you all have, these boards have to prove it. Why do you need to even exist? Well, that's probably a bigger lift than we really need to do too. So I'm going to have a happy medium somewhere that we can, if there were statistics, because I'm a statistics person, I can see a fact. Oh, got it. I don't see a fact, then I kind of go down a rabbit hole and go, why? And the commissioner can probably attest to that because I ask her lots of questions over the years. Why are we doing that? I don't think so. Or then she enlightens me and then I get on board. But I think that was an issue that I'm hoping we can, if anybody else has any similar issues or concerns that I had, I go, hey, the funeral home people don't need to do that because, they're all above board. Nobody ever steals a body and burns it and puts a second thing in a box. And I know that never happens. Well, it has. So there are things we have to be careful with, not lately, by the way. This was 20 some years ago and we perfected that. But I'm just hoping that we all see this and we go, okay, is there a way to fix it? Can we help? And if I'm the only one, I can accept that and that's okay. But anyway, that's why it keeps being brought up.
Thank you, Senator. Mr. Brown.
Thank you. I'm not quite as eloquent as Senator Nolan, but I agree. And I think that there is definitely value. But as we've seen through that history that was promulgated as well, legislatures don't have a lot of carryover from one to the next. And so there may be an appetite to look at that in one session and it starts a program and then it's gone. So I think there has to be an appetite for that going forward at some point, but I think there is value in it. And maybe it is, a decadal thing that we kind of get into some sort of cadence so that comes up that way. But I'm also a little hesitant to just sunsets them all when we have people who are getting licenses and preparing for that and basically setting their career on that as well. We also, I think, need to look at some of the areas, and that came up in the last committee meeting as well, that there are some licenses that have very few individuals in them at this point, and quite frankly, probably going to be even fewer in the future. And we also saw that there were a number of states that do not require some licenses that we require. So are there opportunities to look at those, maybe just kind of hone in on them and focus on those areas and not necessarily, throw the baby in and out with the bathwater, to kind of get some specificity on that as well. But I think there are sunset opportunities, and I think that's something we definitely should keep in the front of our mind, but it's just hard to put it in place and follow the practice going forward. Thank you.
Thank you, Mr. Brown. Along those
And I
lines.
should have mentioned, I'm sorry, Webb Brown Montana Dental Association.
Thank you, Mr. Brown. Along those same lines, let's open this up to the whole task force to consider. Are there particular professions, board structures, or regulatory areas that you believe should be early candidates for sunset review? Does the proposed review framework that you saw in front of you, does it include the same criteria or framework that makes sense or that you'd like to explore? And what coordination is needed with the other subcommittees to ensure that any sunset discussions reflect their findings on safety, on workforce, on access? How are we doing? Let's open this up to the whole subcommittee to provide your input on the work of the subcommittee task force. Mr. Avery.
Thank you, Commissioner. Without rehashing, I think, some of the fun conversations we've had on the Sunset Task Force, I think that Tanner Avery Frontier Institute, maybe should say that as well, too. There is definitely an opportunity for a middle ground here. I think, I think as Senator Nolan said, the conversations of just sunsetting them all, I think gave some people some heartburn pretty quick here too. I think there's a middle ground there where we can be intentional about reviewing this at a periodic way, in a way that we don't have to spend, our entire legislative session going through this process. But at the same time, being intentional of saying, hey, this is, licenses can get out of control. And when we looked back at the history of this, there was a whole number of them. Thank you, Aaron, for all of that information you provided. It was amazing, where we got rid of some licenses that were very clearly protectionist. I mean, there's no secret about that. I think that we've gotten way, way, way better as a state, as a nation, at making sure that we're really dialing in to protect public health and safety. And I feel really good at the spot we're at there. However, it doesn't mean, that the future might not repeat itself, if you will. And so I think there's a good opportunity for us to be intentional about that, but also being realistic to making sure that we can do reviews without going over the top or endangering the public as well. So thank you.
Thank you, Mr. Avery. Are there any other committee members? Representative Buttrey.
Thank you, Commissioner. And before I speak any further, I do want to also thank Erin. She's been an incredible asset. Thank you. Commissioner, it's a little bit contentious, but I don't sit on this subcommittee. But is there discussion at looking at which licensing boards could be turned into department programs, just for the sake of being able to do the work quicker, not have to wait for a board to convene? Is that part of the discussion for one of the chairs?
Mr. Lloyd or Senator Zolnikov, would you like to elaborate?
I guess I would chime in first and offer any thoughts anybody else has. But one of the initial thoughts I had in, thinking through this issue is it's a natural progression. If you've got something that has a board that might not need continued licensure, that you could take that interim step of saying, let's make this a program for some period of time, see if that's the appropriate level of oversight needed, and then transition to fully, doing away with the license. And I want to just highlight, I should have kept track, but I think Tanner used the word balanced like 4 or 5 times. And I think that's, if you've been in any of our subcommittee meetings, you'll know that we have a spectrum of belief on this. And I think it's been really fun to watch all of us kind of agree that something needs to be done. And I'm looking forward to us working together to get to what exactly that is. But I think the idea of stepping it down to a program is one that we'll definitely entertain and have on the table as we go through the process.
Well, Commissioner, and I'm certainly not talking about, boards play an important role in the state, but I think there are some that we could look at taking that step and just to be more responsive, or maybe it's one of those cases where we have a very small number of licensees and then figure out, is that adequate or do we need to go back to full board? So I hope the subcommittee will be looking at some of that. Thank you.
Thank you, Representative. Are there any other inputs from other task force members about the Sunset Subcommittee's work plan? Ms. McCulley.
If I may, from the Board of Nursing, nursing clearly needs to be. And when this was brought up at the very beginning, I was like, why do we have a license for XYZ? And you kind of want to put them on the chopping block. And like I think our good governor said, like the market's going to take care of some of these things. And then I think about the incidents of some bad outcomes are pretty rare, but they're dire. And so we need to use caution when we look at pulling licensees. An example that is pretty clear, we just had prom and all the kids are getting their nail done and they're all doing it for each other. And that's fine because no one's paying and it's all good. But the reason that's licensed is because you can get infections and you can get a diabetic and they can lose their life. And so super, super rare. On the same token, like there's some chemicals that will kill fungal infections and bacterial infections. We're talking about like barbers, and others that don't. And so we don't want to have remove a license to something we don't know about because we think the market might take care of it, because I only know nursing. I know nothing about the rest of it. And I would be real hesitant to remove a safeguard for something that's super rare but could have a real dire consequence.
Thank you, Ms. McCulley. Senator Zolnikov online. I see your hand raised.
Yeah, thank you. And I think it's just healthy to offer a counterpoint on that perspective that licensing can help save people in certain situations, but the economic cost is the thing that everybody who wants to do this has to go through this for an exception that may occur, a bad circumstance that may occur anyway, because even a licensed person can make a mistake. It's the same argument with the speed limits. If you increase them from 55 miles per hour to 65, the amount of accidents go up. I think it's a substantial number. It's like 10 or 15%. And then it does the same for the next 10%. So you can always save lives by having more restrictions in place, but there is always an economic cost and other costs as well. So it's just important to keep that in mind. Just because you find one situation of why licensing is necessary doesn't mean it's the most beneficial thing for all society. Thanks.
Thank you, Senator. Recognizing the need for balance and that sometimes conversations about sunsetting can make folks uncomfortable. Do any other task force members have input on the proposed review framework that Mr. Lloyd shared with us of how they're going about this work and potentially what criteria they'll be looking at when it comes to sunsets or periodic reviews by our regulators in the legislature? Okay. Well, let's open up Senator, go right ahead.
Thank you so much. Under the direction of our wonderful commissioner, who's, if anybody's had the opportunity to talk to her more than 5 minutes, you know she's caring about the whole state. I really appreciate our commissioner for everything you do for our state, and you could be doing a lot of other fun things, but you've chosen to help us, and so I appreciate you greatly. With that, I want to thank Erin one more time for she helps us so much. Thank you, thank you, thank you. It's 3. Okay. But I did want to make a correction or a comment that Senator Zolnikoff said on the speed limit. Be careful, sir. I was the one that wanted the 90-mile-an-hour speed limit, and we did this study, and it was a minimal amount from 85 to 90. But anyway, that's another point. But you brought it up. But regarding the barber and cosmetology issue, so I was one that thought, why are we doing this? This is ridiculous. I mean, let's just be done with that. My mom was a beautician, and when I told her my thoughts, she kind of told me, wake up, and you can really hurt people if you don't pay attention just to your very comments. And but I think we do need to be careful, because I think some of this stuff we're putting in our heads might be not my head, but other people's heads that have hair. Maybe that's why everybody's going crazy in society, because we have gone crazy in our society in a lot of venues. So we need to be careful and not restrict that one. But thank you for your comment. So I'm off that table of taking everybody off, mostly.
Thank you, Senator. Last call for any task force member remarks on the work in front of the Sunset Subcommittee. Ms. Tronstad.
I am curious if a certain profession is no longer licensed and then the public has a complaint, where do they take that complaint?
Yeah, that's a great question, Ms. Tronstad. Alan, is that on your work plan or?
That is not on our work plan, but it's definitely one that we should add. And I work with CPAs, and one of the things that we run into is that, you do not need to be a CPA to do tax returns. And so we have a lot of folks out there that prepare tax returns for folks and have a bad experience and then call and want to complain about their license. And we have to explain the person you worked with has no license. And so I think, again, to the education thing that we've heard a good bit, but that is another one that I think is important. And I think it could tie in with that education effort of, if you have a complaint against one of these professions, this is the place for it. If it's against someone else, here's your pathway to do that. But I'll add that to our list. Erin will probably add that to our list in reality.
Thank you, Mr. Lloyd. And thank you, Ms. Tronstad. I know you've served for a length of time as the public member on one of the boards, and I think you just earned your keep. Thank you very much. That's a great catch. Do any other task force members have questions or input on the Sunset Subcommittee's work plan or the topics before them? Okay. So with that, I'd like to open up public comment specific to the Sunset Subcommittee's topics. If you're in the room and have comment to share with us, please come forward to the microphone, share and spell your first and last name, share your affiliation, and share any comments that you might have with us in the room. Okay. Are there any members of the public online that would like to share public comment regarding the work plan of the Sunset Subcommittee? Okay. Well, next on our agenda is additional member topics. This is our opportunity to surface any issues that you as task force members believe need attention, including any items that were already captured in the parking lot that Erin distributed to you, or any new topics that have emerged through your subcommittee work or through our conversation today, through constituent conversations or the written submissions of public comment that you've reviewed. Does anyone have any additional member topics that we've not covered in any of the work plans that you think we need to be discussing? Okay. Well, with that, the parking lot remains a useful tool for us, but it's not the limit of today's discussion. This agenda really gives us space to make sure that any important concerns are heard and decide how we should incorporate them, either in the task force's work going forward or in other regulatory or legislative work going forward. You have in your list of materials that Aaron provided you the parking lot items that we've identified so far throughout all of the work of the subcommittees. I'd invite members in the room or online to either raise your hand or make comments about any additional parking lot topics that either are not included in one of the subcommittees' work plans or that you believe we've missed. Are there additional topics we need to explore that should be added to the parking lot today for more staff research as we move forward?
Madam
Ms.
Chair.
McCully. Oh, one second, Ms. Hensley. Ms. McCully.
If you would, please, Aaron, add in the concern about the cross-section of barriers in healthcare with detention center and that area.
Thank you, Ms. McCully. Ms. Hensley online.
Thank you. It's mentioned somewhat, but I want to make sure that the specific nuances captured. What I brought up at, I think our first all-round meeting and maybe one of the healthcare meetings is credentialing / payment by insurers. It's, again, not under Title 37, but I would hate to see it completely slip through the cracks as an opportunity to elevate as a potential bill for one of those smart legislators on this task force to carry up and run with, maybe a requirement or looking at having insurers have a provisional credentialing process in place for those trying to get paid by insurers or get credentialed by insurers who have already been licensed by the state. It's just one more concurrent process that can occur if A, permitted to, or be required to. Again, I have not refreshed myself on the insurance statute in a couple of years, but I did want to specifically point out the credentialing by commercial insurers on this task force.
Thank you, Ms. Hensley. Are there any other parking lot comments or concerns from members of the task force, either in the room or online? You all should have it in front of you. And I'm really curious to know, are there any items on the parking lot that you feel stronger should be added to a work plan? Or is this reflective of all the topics that we've agreed need to be parked for now for future work? Senator, go right ahead.
I know I haven't spoken up very much today, but so I brought up I'm trying to remember which committee this was in, because I think I'm on all of them. And then if it doesn't apply to this one, Aaron, you can kick me and say that was in Economic Affairs. But with insurance, I had some issues and I wanted it addressed. Insurance agents, and so I called a bunch of insurance companies in the Flathead and asked, I'm on these boards and how do you feel things are rolling for your standpoint? They think great. And I said, do you do your job? Now, I was on a panel 3 months ago, and insurance companies and bankers were there. And so I got to ask them point blank, do you do good service to the people that you insure? Are you, and they said, what are you talking about? And I said, do you go over with them what their policy is? Yeah. When you sign them up? Yeah. Now, when you're 80 and then you don't, they just keep re-upping and re-upping and you're in your 60s now or something. How much do you enlighten them of what's in their policy? Because I don't think you're doing your job. Now, they didn't like that, but that's all right. Insurance doesn't like me anyway. I said, you need to do your job and help those people know what they're doing. So if we have a licensing board regarding insurance, I said, we'll just pull it. Now, obviously they know I can't just do that, but I could probably make a big stink about it and maybe bring a bill and then they all have to come and testify. I said, just I'm hoping that you will all do that. So I'm sorry I'm taking a little bit of time here, but insurance was an issue for me. Insurance agents so I talked to the insurance lobbyists, some of them, and I said, I think that's what they need to do. How often do you review what a policy is? because we're talking about fires specifically in their neighborhoods and things, and wildland fires and stuff, and they're boarded your house. People don't remember. No, it's our own job as a homeowner. You should know what your policy is. But isn't it when you're paying that fee to your insurance company every month or annually or however you pay it, you're hoping they're going to take care of you. And I said, I don't think some of you are. I got a little bit of communications. My emails kind of blew up and I responded back. So I just wondering if anybody else has those as an issue. I have insurance as an issue. I want to look at theirs. So that might be one that we might look at and see if there's a need. Maybe everybody else's insurance is perfect and you're all happy to pay that 34% increase that you got. Yes, I'm so excited. And then they don't even tell me that I am not covered under a certain thing. Flood, wind, hail. I have a bunch of cars. And so some of them I forgot that I didn't put insurance on, and well, why didn't you catch that? Well, it's your job. You're the owner. And I go, I'm paying you something. So anyway, that's an issue that I had. Thank you.
Thank you, Senator. So just to clarify, under the identified parking lot topics for the task force, there is an item on there right now that is more narrow, healthcare reimbursements for healthcare providers. But if I understand you, you want to add a broader insurance parking lot topic that we can look at for other categories of insurance.
And really not trying to make more work for all of us, but I am on 4 committees, so I guess I'll be on one of those if we do. But if nobody wants to, fine. If you do, it's an issue for me.
Thank you, Senator. Representative Buttrey.
Thank you, Commissioner. And I had talked real briefly about this in our initial organizational meeting, but this came to me. I have some experience in real estate, and there was a person that had been aspiring to become a real estate broker for some time, came to me, and they had been involved heavily in real estate as an agent, had done hundreds of transactions, but could not simply become a broker because they just were one of those people that can't pass a test. And so I thought about this a little more broadly, because we haven't talked about it since. Is there a mechanism for these boards to do something in lieu of a test if they run into one of those people that can do maybe something more spoken versus a written test? And if there's not, I would think that would be something the barrier subcommittee could look at as alternative to testing for those. There's got to be more than just this one person for people that would have that challenge. And we're, in essence, it's a barrier to licensure simply because they can't sit down and do very well on a written test, even though they have the knowledge.
Thank you, Representative. That's a great point. I see Erin has furiously taken down a number of notes. I'm sure she'll follow up with you and we'll figure out where that fits.
Thank you.
Madam Chair,
Ms. Hensley.
sorry for speaking twice here. First of all, I forgot I was supposed to thank Erin, but thank you, Erin. And also, listening to, I want to say it was Economic Affairs Interim Committee, but it could have been a different I think it was Economic Affairs. There was recently a presentation on property managers, licensure of property managers, what constitutes a property manager, et cetera, and what sort of folks need to be licensed. And I'm thinking that there might be some activity in the interim policy committees that will end up maybe expanding licensure requirements while this committee, this task force is concurrently trying to look for ways to streamline that. And I know that Ms. Sullivan is all things to all people. However, sometimes even the best of us fail. And so I was hoping that there could be maybe coordination with interim policy staff to maybe just take stock of what we see on the horizon from interim policy that could be contrary to what this task force is going to be advancing.
Thank you, Ms. Hensley. That's great. We've got that captured, adding a potential task force topic around exploring licensure for property managers and who needs to be licensed and who doesn't. Thank you. Ms. Reisberg.
Yes, thanks. Thank you, Commissioner. Thank you, Erin. The testing alternative is also something that has come up with the social workers. There's lots of candidates who have been in the process for so long and they just can't pass the test, but they've completed all of the other requirements. So I think that would be something that would be good to look into there too.
Thank you very much. Are there any other task force suggestions for either additions to the parking lot or things that should be moved off the parking lot onto a work plan? Mr. Brown?
Thank you, Commissioner. First, thank you, Aaron. Got to get my 2 cents in there. And I've also brought up the point in committees and subcommittees as well. Let's not load Aaron up with more as well. So she's got plenty on her plate already. And I jump back to the good moral cause issue as well. That's such a slippery slope. I would rather we just get rid of it completely. I think sometimes people, and I hear the comments too, that people are confusing it with legal activities or criminal activities, and they're not the same. So I think we should be very careful about adding a lot of work to Erin to ask her to chase this rabbit trail as well. On the alternative testing, I'll give you an example as well. Of course, during COVID, when you weren't able to do activities with live patients, a lot of the dental exams went to mannequins instead so that they could use the mannequins. We actually do a little radiology exam for dental assistants so they can take x-rays. And if someone has trouble taking a written exam in a certain time frame, in a crowd as well, we provide alternative accommodation for them. So I think it can be done overall. But those are good points. They can truly be barriers for people overall. Thank you.
Thank you, Mr. Brown. Ms. McCully?
Quick point. Thank you. As a psychiatric nurse practitioner, there's testing that allows you to identify how to test well. And there's exemptions that I've written for many people across the board for things. And so there are ways to change the testing environment. And so I don't know if it's something that we need. I don't know how far you want to get into it, but there is more for that.
Thank you.
Commissioner,
Yes.
I think
Representative.
sometimes in the legislature, at least in my tenure, we've seen things that boards can do and some do and then some won't. And so at some point it falls to the legislature to say you must provide some other alternative. I don't know if that comes into play, but Commissioner, also to Mr. Webb or to Webb's comment, the good character. We did talk about that, and one of the options was removing those words from licensure. We have to make sure that that if we do that, that we're not violating some other national code or a compact. So that's what kind of led us to, we're going to look and see if that's required elsewhere. And if it is, then maybe it's a definition that would say, you know, good moral character means you haven't done these small set of things. So at least it's less subjective.
Thank you, Representative. Are there any other task force members that have feedback on the parking lot tasks, things that should be added to it, things that should be assigned out from it? Okay, I'm going to repeat back to you really briefly what I think I heard that has been assigned to the task force parking lot, that Erin will do some research and will bring it to each of you in subcommittees to decide if you want to take it up. We've got a topic around a more broad insurance regulatory review from Senator Noland. This testing alternative discussion could be quite broad, whether it's oral testing or other testing modalities, whether it's using mannequins versus patients, a broad topic around alternative testing requirements, a request from Ms. Hensley to more deeply explore property managers licensure and maybe some definitions around the kind of property or the kind of individuals that need that license. And last but not least, from Representative Buttrey, the good character conversation and whether that's a stronger definition or more specificity around utilization of good character requirements. Have I missed anything important to any of you?
Ms. Thompson, to clarify, I don't think that we should explore anything about property managers specifically. My concern was that interim activity is occurring that could bring forward suggestions that are contrary to what this task force is suggesting. And I just want us to be aware of that on the periphery. That's all.
Thank you for
no
clarifying.
shade to property managers. Yeah.
No problem. Thank you, Ms. Hensley, for clarifying. So restating that parking lot topic is a pretty broad scale review of what our legislative interim committees are doing and how it might impact the work of this task force. Wonderful. All right. So next steps, before we close, I just want to make sure that Erin, who you all know is amazing, and all of the other Department of Labor staff who are equally amazing and who stand behind her every day to make her amazing, I want to make sure they have good, clear direction. For each subcommittee, I want to pause for a minute and give the co-chairs of all 4 subcommittees a chance to briefly state any additional data, analysis, or support that you need from Ms. Sullivan and the rest of the Department of Labor before your next meeting. I don't know who wants to go first, but if you are a co-chair, if there is data, analysis, or support that you need to do the work of co-chairing your group, now is your time to share that with Erin. So we have a good to-do list for staff. Mr. Harvey, Senator Harvey, excuse me.
Yeah, Commissioner, Aaron, I think it was brought up by the commissioner at the end of our presentation. Maybe if we could plan a little bit of time to just review the license lookup and how that looks online.
Thank you, Senator. Any other co-chairs? Is there data, analysis, or more support you need to prepare for deploying your work plan? Easy peasy. You nailed it. Thank you. All right. So thank you. We will work together with Erin and the rest of the staff to prioritize your work and your work plans, to assign some of the research on the parking lot topics that we discussed today, and to add a licensee lookup and overview for each of the subcommittees. As a reminder, we've got 4 upcoming meetings. The next meeting of the Healthcare Subcommittee will be this Friday, April 17th at 9 a.m. The Sunset Subcommittee will next meet on Friday, April 24th at 9 a.m. The Construction Subcommittee will meet on Friday, May 1st at 9 a.m. And the Barriers Subcommittee will meet Friday, May 8th at 9 a.m. All of those are fully virtual for yourselves and the public to participate. At our next full task force meeting, which will be on the road, we will be in Billings at City College on June 8th. I'll be looking for each of our subcommittee co-chairs to bring a refined list of your priority issues, any early options or concepts for each reform, and a clear sense of what additional information or data or analysis you still need from us at the department or from other agencies to make your recommendations, both to the task force and ultimately to the governor. With that, I'd like to open it up for general public comment. We'll open the floor for any topic that has not been on the agenda today that any members of the public, either in the room or online, would like to share with us today. Same rules apply. Please say and spell your name for the record and state your affiliation. If there is anything else pending before this task force that we haven't discussed today that you'd like to share as a member of the public, please do that now. Okay, well, I think we covered it. I want to close today by again thanking each of you for serving on this task force, for the countless hours that you're putting into your subcommittee work and the research, and for the seriousness that you're bringing to these conversations. They have real impacts on Montana's workforce, on our licensees, and on the public. And I'm really grateful for the time that you're putting in. I also want to thank the members of the public and the licensees themselves and their advocates who have been engaging throughout this process by submitting comments, by showing up to meetings, and by sharing what's working and what's not working in our licensing system. Your input is really essential to getting this right. So thank you, thank you, thank you for engaging. I'd like to thank Director Krukenberg and the staff here at the Montana Historical Society. This is a beautiful venue with the new Heritage Center and especially this conference space that they've made available to us. And I'd again like to thank all of the other members of the DLI staff that stand behind Erin to make her look quite this good. And to all of our legislators in the room, I'd just like to make very clear for the record that you cannot have her back. We won her fair and square. So she's ours. This is really hard work. I know licensing is deeply personal and can be emotional to folks. It asks us to balance public safety, professional standards, workforce needs, and people's ability to go to work every day. It is really important, and I'm confident that we can deliver recommendations to the governor and ultimately the legislature that balance these needs carefully, and thank you for what you're doing to help us move that forward. If we can stay focused on the people behind the rules, the patients, the consumers, the citizens that need these professionals, I'm really confident we can deliver strong recommendations to all of our partners in September. So thank you again for your time, your engagement, and all your hard work. And if no task force members have any additional business, we will adjourn for the day. Thank you very much.